Winning the battle against epidemics does not lie in the hands of experts. One man who was on the front line battling Ebola in the 1970s says it's in the hands of the people who are most affected. And Professor Peter Piot helped discover the Ebola virus in 1976 and was a key part in research into HIV/AIDS. CNA's Loke spoke with him in Singapore shortly after the World Health Organization finally agreed to declare the Wuhan coronavirus outbreak an international emergency. Professor Piot says it should have come earlier.
It came a bit late because already last week when the committee met at WHO, it could have declared this a public health emergency of international concern because there were already not only lots of cases in China but also in a growing number of countries, and that means that it is of international concern. But better late than never, and anyway the most important thing is that no country waited for that declaration to put in place measures to contain this epidemic.
Does that worry you that they did not wait and each one came up with its own piecemeal, potentially haphazard and possibly irrelevant measures to contain their own national concerns?
It would obviously have been much better to declare this epidemic as a public health emergency of international concern, because maybe then countries would have worked closer together to put in place similar measures. But at the end of the day, all countries have reacted, and there are slight differences, but most of the time the measures make sense. The basic principles to contain this kind of epidemic of coronavirus are the same. And for countries outside China, what's important is two things. One is to make sure that anybody who comes from China, particularly from Hubei province, with the infection is detected at entry into the country and can be isolated, so that, and then secondly, that there are no secondary infections within the country. Now there are measures that are popular and people will practice because it makes them feel safe. For example, masks. Now masks, you see it, I saw it here in Singapore even on arrival at the airport and in the bus I took this morning. Masks are there and are essential in a healthcare setting, definitely, because that's where there's a higher risk. And also if you feel that you're ill, to protect others. But wearing a mask while walking in the street or so, frankly, that doesn't make much sense. That's not going to make a difference.
On the question of masks, a few days ago there was information on the internet saying you could be contagious even before you have any symptoms, hence the wearing of masks. Now that's being called into question, so we do not wear masks, or we do wear masks. I think the public wants to know very black and white, what should we be doing? Does science find it hard to keep up with this kind of demand?
There's a double reality here. One, science is still incomplete. There are many uncertainties around this disease. Let's not forget that the virus, the coronavirus, was only isolated less than 3 weeks ago. And so in no time have we made enormous progress, but we don't know all the details. For example, when exactly you're becoming infectious. Secondly, how long does it take between contact with someone who is infected and that you become ill yourself? We think it's about 5 to 7 days, but there's probably a range. So the science is not 100% certain. And then secondly, I fully understand the reality of people's anxiety, but there's also a lot of, let's say, fake news that circulates. And how to sift that from, hard facts is not always easy. And that's why also we scientists, we have to do a better job in communicating. You cannot win a battle against an epidemic if the people are not with you, if people don't understand what's going on, if they're not really engaged in the response. Experts alone cannot win this. The fundamentals will be the same. We know that, and it sounds a bit medieval in our 21st century of high-tech medical care, that it's still limited to isolation and contact tracing and so on, because we don't have a vaccine, we don't have a therapy. But we need to listen to people. That's really important, and constantly adapting the messages to what we hear.